Hello guys, my name is Dr. Wajid Khan. We'll deal with this topic of neuro-ophthalmology. Okay. In neuro-ophthalmology, we'll discuss about the optic neuritis and the retrobulbar neuritis. What is meant by the term optic neuritis? What is meant by the term optic neuritis? Optic neuritis is inflammation of the optic nerve involving the optic disc also, that is called as optic neuritis. Retrobulbar neuritis meaning what? Inflammation of the optic nerve which is not involving the optic disc. Yani the back portion of the optic nerve is getting involved and inflamed, not the optic disc. So anyways, we are discussing about optic neuritis, that is inflammation of the optic nerve with optic disc getting inflamed. In this optic neuritis, what is the common cause of it? Why does this optic nerve gets inflamed? The most common cause of optic neuritis is multiple sclerosis. Apart from multiple sclerosis, they are idiopathic causes. Multiple sclerosis, apart from that, they are idiopathic causes. So guys, in optic neuritis, if the patient is having optic neuritis or inflammation of the optic nerve with disc, what are the clinical features? Patient will have sometimes painful or sometimes painless loss of vision. While moving his eyes, as the movement of the eyeball is controlled by the nerve, while moving his eye, he might have pain in the movement, pain in the ocular movement. That could be the clinical features. And the most important sign that you see in optic neuritis is what guys? Normally, when you put a light into the patient's eye, what do you see? What will happen to the pupil? The pupil will constrict. Reacting to the light, the pupil will constrict. But in optic neuritis, there is no constriction or ill constriction of the pupil, which is also called as Marcus gun pupil, which is also called as relative afferent pupillary defect, RAPD, relative afferent pupillary defect. So optic neuritis. Optic neuritis is an inflammatory and demyelinating condition of the optic nerve involving the optic disc. The patient will have a painless loss of vision and a painless as well as painful loss of vision. Patient will have pain on ocular movements, particularly in what movements? Upward and medial movements. Apart from that, I forgot to tell you, patient will also have color desaturation. Patient is not able to differentiate the red and green color. The main feature in optic neuritis is what? The abnormal pupillary reaction, not papillary, pupillary reaction. What is that pupillary reaction called as? Marcus gun pupil, also called as relative afferent pupillary defect. What is that Marcus gun pupil, guys? Ill constriction of the affected pupil. Ill constriction of the affected pupil. Marcus gun pupil is what, guys? Ill constriction of the affected pupil is called as Marcus gun pupil. Yani basically the pupil is not getting constricted even though you pass a light. That is Marcus gun pupil. Okay. So guys, what do you see in optic neuritis? When a patient is coming with optic neuritis, examine the patient's eye, you will see optic disc edema, right? The margins of the optic disc becomes blurred, hyperemic. How will you manage this optic neuritis? On investigation, you will find the optic disc is getting blurred, the margins are getting blurred, optic disc getting edematous. But how will you manage this optic neuritis? Management of optic neuritis, the best management is giving the patient steroids. Giving the patient steroids, that is the main management of that's the main management of optic neuritis. Next, coming to retrobulbar neuritis. What is meant by the term retrobulbar neuritis? Retrobulbar neuritis is also an inflammation of the optic nerve it's basically the inflammation of the back part of the optic nerve, not involving the optic disc, right? Not involving the optic disc. Retrobulbar neuritis, there is no signs, there is no symptoms. Yani ke patient won't complain of anything, doctor won't find anything, right? It is an incidental finding. It is an incidental finding, or sometimes it might be presenting in a very low or very last stage. Okay. So retrobulbar neuritis here, there is no optic disc is not at all affected, but other features could be seen. Other features means the patient might have painless loss of vision. When a patient is having loss of vision, then only he'll come to you. Okay? It's a condition where the patient doesn't see anything, the doctor doesn't find anything. It's an asymptomatic condition. It's an asymptomatic condition. You might see papilla edema. Papilla edema is the first sign of this condition called as retrobulbar neuritis. What is papilla edema? Edema of the optic disc is called as papilla edema, right? So retrobulbar neuritis also treatment is what? You give steroids to the patient. A person who's suffering with retrobulbar neuritis, you give steroids to this person. Steroids to this person. This is regarding optic neuritis and retrobulbar neuritis.